Okay, Baltimore City Council Ways and Means Committee, we are back for Council Bill 21-0080, Ordinance of Estimates for the fiscal year ending June 30, 2022. I'm Mayor Costello, Councilman for the 11th District, Chair of the committee. I am joined this evening by Councilwoman Odette Ramos, 14th District, Council Vice President Sharon Middleton, 6th District, member of the committee, Councilwoman Danny McCray, 2nd District, member of the committee, Councilman Isaac Yitzi Schleifer, 5th District, member of the committee, Councilman Mark Conway, 4th District, Councilman Chris Burnett, 8th District, member of the committee, Councilman Zeke Cohen, 1st District, Councilman Ryan Dorsey, 3rd District, member of the committee, Councilwoman Felicia Porter, 10th District, Council President Nick Mosby. Joining us on behalf of Mayor Brandon Scott is Natasha Mehew and Nina Themelis. Joining us on behalf of Council President Nick Mosby is Matt Stegman and Nikki Thompson. Marguerite Curran is staff to the committee. We are here this evening for the Health Department. This is the last session for day one of budget hearings. With that, we have Dr. Shiraza in chambers with us. Doc, please take it away.
Good evening. Thank you, Chair Costello and fellow council members. I am honored to be here tonight presenting the FY22 budget for the Health Department. As Councilman Costello mentioned, my name is Patricia Jarasa, and I am the Health Commissioner for the Baltimore City Health Department. I thought I would start with providing an overview. I think the Health Department certainly is known for our COVID-19 response, but prior to the pandemic, we were tackling many public health challenges. This is a brief list of our many service areas, including emergency preparedness and response, which has been instrumental in providing this response. Our acute communicable diseases, which many now are familiar with because of their contact tracing efforts around COVID-19. Additionally, we have environmental inspection services that perform restaurant inspections. We have our field health services, which are responsible for non-emergency medical transport for residents that are chronically ill to medical appointments. We have our clinical services team, which have supported clinical services at both Druid on the west side and 1200 East Fayette Clinic on the east side. They provide HIV and STD prevention services as well as childhood immunizations and are supporting current immunization efforts. We have our Ryan White and Community Risk Reduction Services, which support HIV and STD prevention, as well as provide syringe exchange services and mobile spot treatment. We have our school health team, which provides school health services to over 80,000 city school students. We have our chronic disease prevention work, which supports preventing chronic diseases in the long term. Our Office of Youth and Trauma Services, which address youth and trauma violence or victims of violence. We have our overdose prevention and substance use disorder work. We have our animal control services, which support the animal rescue shelter, as well as supports any complaints around animals with rabies. We have our client services for older adults in our Division of Aging that supports advocacy and care coordination for our older adults. We also support senior centers across the city. And we have our maternal and child health program, which includes our Baltimore for Healthy Babies program, Women's Infants and Children, and our Infants and Toddler program. Again, not a fully comprehensive list, but just wanted to highlight some of the other services that I'll be talking about today. So to start with our COVID introduction, we continue to lead the city's response. To date, we continue to stay in our Incident Command Emergency Response structure. 70 staff are still deployed full-time to the COVID response, with 100 staff across the department deployed part-time to the response. Over 300 temporary staff have been brought in to support major areas of the response, including testing, contact tracing, vaccination, and our outbreak investigation efforts. Our priorities remain minimizing spread and instances of outbreaks and death as it relates to COVID-19, and we do this through testing and contact tracing, minimizing reductions in service delivery by increasing the protection and resiliency of the city's workforce, increasing our COVID-19 vaccine uptake to achieve herd immunity here in Baltimore by early 2022, providing education and outreach so that we can address vaccine hesitancy with a particular focus on populations that have been disproportionately impacted by COVID. Our estimated cost as it relates to the COVID-19 response for FY22 is $35.5 million, And we anticipate that much of these costs will be reimbursed by the CARES Act, FEMA, and other federal, state, and philanthropic funding sources. We have restructured and broken down our response into 4 functional areas, including operations, logistics, planning, and administration. You can see a line item of the budget below, which includes covering case investigation and contact tracing, which will be ongoing throughout the response, our emergency food plan, our COVID-19 testing, the isolation and quarantine services provided at the Lower Baltimore Hotel, and ongoing vaccination work. Beginning with service number 303, which is $7.6 million, this is our clinical services team. So again, this is our East Side and West Side clinics, where we provide both STD and HIV prevention services. We also support a mobile clinic. We provide testing through our lab. We provide a tuberculosis clinic, and we provide dental services. We serve many residents who are uninsured or underinsured and the most vulnerable here in our city. We have about 16,000 unique patients with about 18,000 visits per year. Looking at service area 305 with a budget of $2.9 million. This is our lead and asthma prevention program. And this program is responsible for many home visits to families that have been, or households that have been identified as being at risk for lead exposure, or families with children with asthma that is poorly controlled or just in need of additional support. So provides care coordination for these families, discusses lead safety with the families, and provides integrated pest management where needed. The one noticeable thing for this particular budget item is that there was an additional cost of about $387,000 related to an increase in rent and operating costs, as this program will be moving to a new facility. Our next service area is substance use disorder and mental health, service number 307. And this is specifically funding that goes to Behavioral Health System Baltimore. Behavioral Health System Baltimore serves as the local behavioral health authority, and their job is to advocate and help guide innovative approaches to prevention and early intervention, as well as treatment and recovery for those with mental health and substance use disorder throughout the community. They do this through policy and advocacy. They also do this through raising public health awareness around behavioral health and substance use disorder. And they allocate resources to other community-based organizations that provide substance use and mental health services here in Baltimore City. They are responsible for putting on the pilot program that will be diverting 911 calls away from police to social workers and mental health support beginning this month. These will be trained specialists who are used to addressing clients with suicidal ideation and can be redirected to support ongoing mental health needs. The costs will come out of the existing contract, and no additional funding has been added to support this new service. Next, we have Service 308, Maternal and Child Health, with a budget of around $27 million. So this is our division that is responsible for supporting birth outcomes, appropriate and positive birth outcomes here in Baltimore City, that addresses the disparities and gaps we see in infant mortality as well as maternal mortality, and provide care coordination for eligible pregnant and postpartum women, including nursing home visiting programs. They also enhance readiness for kindergarten, provide nutritional support through our Women, Infants, and Children program, as well as provide developmental support for infants who've been identified as having developmental delays. This budget does create one health program admin 2 position in maternal and infant nursing activity, and transfers 1 grant service specialist position from Service 720. Next, we have School Health Services, or service number 310. So this is the part of the division that is responsible for providing school health services in our health suites, as well as school-based health centers throughout Baltimore City Public Schools, serving over 84,000 students per year. They perform mandated immunizations. They provide health case management and care coordination. They coordinate with primary care, mental health, and substance use disorder services across the city for the students that they see. They also support students with chronic diseases such as diabetes and asthma, and provide skilled nursing management. This budget does transfer 2 grant-funded positions to a special revenue fund that will be supported by Baltimore City Public Schools. Next, we have Health Services for Seniors, or service number 311, which is about $5.3 million. And this supports our Adult Evaluation and Review Services, or our AIRS program. This program specifically identifies residents that have the Medicaid waiver and are in need of additional community services in order to be able to stay within their homes. They may be older adults or people with underlying disabilities. This program is grant funded and does receive some special revenue due to fee-for-service components. This particular budget maintains the current level of service. Next, we have Emergency Services Health, or service number 315, with a budget of $46 million. So this is the particular area that is housing much of our response efforts and much of our response costs. So this is the service that includes our public health emergency, how we address public health emergencies through our Office of Public Health Preparedness and Response, our Office of Acute Communicable Diseases, which addresses outbreaks, and we also have our Field Health Services team, which transports chronically ill individuals in the city to medical appointments. They continue to provide ongoing support, certainly of the COVID response, but also of Code Red, Code Blue in the winter, and continue to investigate other outbreaks in addition to COVID. So this includes $8 million in CARES Act funding and an estimated $27.5 million in FEMA reimbursement. It also includes the costs associated with triage, respite, and isolation at the Lord Baltimore Hotel, funding of meals and food for older adults. And I just want to point out that in fiscal year 20, they performed 212 investigated outbreaks compared to the typical 24 to 37 done in previous years. Next, we have service number 316, or Youth and Trauma Services, with a budget of about $1.6 million. So this service is focused on connecting young people that have been victims of trauma or violence directly to mental health services or other stabilization victim services. They continue to work within our city schools around violence prevention. And this is also the office that is responsible for supporting the Healing City Act here in Baltimore City. This budget does fund the creation of a program assistant 2 position and eliminates 1 vacant community health educator 2 position to make it budget neutral. And it transfers 1 health program admin 2 position from the federal fund into the general fund. This program has continued to do trauma-informed care trainings throughout fiscal year 20 and continue to connect residents that have been victims of violence with support services. Next, we have administration, or service number 715, with a budget of about $14.8 million. So this includes the executive leadership team, external affairs, fiscal services, human resources, grants and policy development, as well as epidemiology and planning within the health department. And this is a team that really guides our agency's delivery of services and ensures compliance with local and state as well as federal laws as it relates to our grants, as well as it relates to the auditing process. This budget, yes, maintains its current level of service, just creating 1 new general fund position in health fiscal services. Next, we have service number 716, or animal services. So this is our Office of Animal Control that enforces all codes, rules, and regulations, focused on the animal population, as well as protecting residents and preventing zoonotic diseases and animal attacks, and also supports the Baltimore Animal Rescue and Care Shelter Program. This recommended budget maintains the current level of service for this service number. Next, we have environmental inspection services, or service number 717, with a budget of about $3.1 million. And this is inclusive of our team providing inspections of food service facilities and other facilities requiring sanitation in Baltimore City, including swimming pools, institutional facilities, and tattoo operations. In the fiscal year 20, we upgraded to Acela, which is a new virtual restaurant inspection system, allowing the development of electronic inspection and permitting the system to include online renewal of permits. This particular service area has continued throughout the pandemic, initially performing virtual inspections, as well as supporting the COVID-19 response, being reassigned to do many of the isolation and quarantine support, as well as call intake and triage for the Acute Communicable Diseases Program. Next, we have service number 718, or Chronic Disease Prevention, with a budget just under $800,000. And this particular office is focused on health promotion and disease prevention. So this is our work around tobacco cessation and providing tobacco prevention education. This is our work around tobacco enforcement as well. This is a work around the Cancer Coalition and Baltimore, as well as the Diabetes Coalition. Next, we have service number 720, which is HIV treatment services for the uninsured, which is a budget of about $55 million. So this is what we call our Ryan White program. This is federal funding focused on providing comprehensive treatment services to HIV positive people. This includes case management for those living with AIDS, as well as STD and HIV prevention services, and general prevention of HIV infection in high-risk individuals. This also includes our syringe exchange services program, and this recommended budget maintains the current level of service. Next, we have service number 721, or our senior centers, with a budget of about $3.3 million. So this is supportive of our older adults above 55, persons with disabilities, and caregivers who wish to keep residents active and engaged within the community. This supports the work of our 7 senior centers, as well as our 5 nonprofit senior center partners. And this budget supports the current level of service. It did eliminate 1 social program administrator position. And next we have service number 722, our administration and care. So our Division of Aging actually serves as a designated area agency for aging and is responsible for planning and coordination of a comprehensive service system for older adults. So this service addresses the administration of federal and state grants for older adults and adults with disabilities. Next, we have service number 723, or Advocacy for Seniors, which with a budget of just under $900,000. This is our Maryland Access Point, a referral line for older adults wishing to be connected with resources. This includes our Ombudsman program, which is a program that provides advocacy and support for older adults, addressing any complaints that may come up for adults that live in the long-term care system. This recommended budget maintains its current level of service. And then next we have our Direct Care and Support Planning, or service number 723, with a budget of $2.7 million. So this includes our guardianship program, specifically supporting older adults that are Medicaid eligible, cognitively impaired, disabled, or maybe chronically ill and reside in their home, an assisted living facility, or institutional setting. So this ensures that we can advocate for those individuals who can't advocate for themselves, supports planning, and supports intervention as needed for those adults. And then lastly, we have our community services for seniors, or service number 725, with a budget just over $5 million. So this supports core needs of older adults, including our transportation program, our health education program, as well as nutrition program. So even prior to the pandemic, we were doing home meal delivery and transitioned very quickly at the beginning of the pandemic to provide even more meals through our partners at the Salvation Army and Meals on Wheels. These costs are expected to be reimbursable through federal funding. And that concludes the slides for health.
We're also joined by Faith Leach, who is our new Deputy Mayor for Equity and Human Services. I think I said that correct. Is that right, Deputy Mayor Leach?
It's Equity, Health, and Human Services.
Equity, Health, and Human Services. Got it. Thank you, ma'am. Appreciate you being with us this evening. Mr. President. Mr. President. Councilwoman McCray.
Thank you, Mr. Chair. I just have one question right now. It was mentioned, and this is regarding Service 308, Maternal and Child Health. It was mentioned that COVID-19 has reduced client visits. I just want to know what shifts has the department made to ensure that as many of our clients are being served as possible while in COVID?
Great, thank you, Councilwoman Cray. I actually have Assistant Commissioner for Maternal and Child Health on the line, Ms. Rebecca Deneen.
Hi, yes, it's great to be here. Thank you for the question. All of our services for maternal and child health have continued through the pandemic. WIC has been open, but telephonic. Our maternal home visiting services have also been telephonic, as have been our early intervention services. So the services haven't closed down. What we have noticed, however, is that in the beginning of the pandemic, and we're just starting to see the numbers now, in the first 7 months of that pandemic, a lot of people were not going to their prenatal care providers, which meant that we weren't getting prenatal risk assessments. And the prenatal risk assessment is an assessment that actually links women into a whole number of different kinds of care coordination services. And because that didn't happen, a lot of linkages were not made into the system. So we are rapidly looking at those numbers and seeing, what transpired. But because many clinical visits were telephonic, a lot of that general system that we have for prenatal risk assessment, that's actually directed through Medicaid, wasn't happening in the way that it does non-pandemic and is happening now. So what we've been doing is primarily, to respond directly to your question, is doing work through telemedicine, and we are making sure that all our staff are vaccinated. And as soon as we have to go ahead to start visiting in the homes and to start our services up again through our WIC sites, we're just waiting for federal and state and citywide approval to do that. But it's certainly an area of concern for us. I think there were a lot of people who did not get their routine healthcare visits, and because of that, weren't linked into the services that they normally would have been in a non-pandemic year.
I believe you answered my follow-up question, but I just want to be sure. The reason why we're not doing in-home visits is because we are waiting from guidance.
Yes.
To do so. Okay.
Yes.
Thank you, Mr. Chair.
Yeah.
Thank you. Councilman Cohen.
Thank you, Mr. Chair, and thank you, Commissioner Duraza, for your leadership throughout the pandemic. Thanks especially for your partnership and ongoing commitment to trauma-informed care. It's been a real pleasure getting to work with you and Mr. William Kellebrew on the Healing City Act. And as you know, in 2020, our city became the first in America to comprehensively legislate trauma-informed care through the signing of the Healing City Act. Since then, we've been hard at work. Yet when I look at service item 316, youth and trauma services, I see a pretty precipitous decline from fiscal year 21, where we spent $2,467,437 to fiscal year 22, where we are intending to spend about $1,650,890, which is a drop of over $800,000. And I'm glad to say that in conversation with the mayor's team, the administration intends to provide some supplemental support so that we can do the work of the Healing City Act. However, it's still a pretty big drop. So I wondered if you could explain the decline from fiscal 21 to fiscal 22 on that service item.
Sure. Thank you for that question, Councilman Cohen. I will begin, and I'll certainly let the Director of the Office of Youth and Trauma Services, William Kellebrew, jump in. So this area is grant funded federally, and we did see a decline in that federal grant funding from fiscal year 21 to 22, which explains the precipitous drop. Director Kellebrew, if you would like to add anything to that, please feel free.
Yes, Councilmember Cohen. Thank you, Dr. Duraza. Yes, we did see a drop in funding from federal funds. We have had the grants supporting male survivors for violence for about 5 years. And so that sort of waned off from the DOJ. We also had a grant from the CDC that will be ending in August 29th, 2021. So there are some natural ending points for these particular grants. But I will say that we are looking forward to our recast funding to continue. which we put the application into the Substance Abuse and Mental Health Services Administration at the tune of $5 million. And so we look forward to keeping those funds, but we realize that these federal funds are very competitive grants. And so it causes a challenge for us in many ways.
Yeah, no, thank you both for that. I asked this question in part to say that I think that as a city that's really a leader in public health, we should be less reliant on federal grants, and we should really fund your office more from our general fund so that that money doesn't disappear. I mean, we're talking about youth and trauma, we're talking about lead poisoning, older adults. I mean, this is all critically important, mission critical stuff. And so I'm curious with my second question, do you know about what percent of your budget is state and federal grants versus how much we, the city, contribute?
We're
Not
about
off the top.
80% grant funded. If you're speaking of the total budget, we're about 80% grant funded, about 20% general fund.
Gotcha. Great. Well, again, thank you for your leadership. I would just say that that proportion to me is way out of whack, and we need to do more to support the critical work that you all are doing. Again, thanks for your leadership. Thank you, Mr. Chair.
Thank you, Councilman Schleifer. And then we have Porter, Burnett, Middleton, Ramos. Porter, Burnett, Middleton, Ramos. Schleifer.
All right, thank you, Mr. Chair. Health Commissioner, how many people have been vaccinated by the Baltimore City Health Department to date?
That's a great question. And I think we may have a few people who can support. Deputy Commissioner Martin is on the line. I also believe Dr. McDowell might be on the line as well. And if we can't get that number for you right now, we can certainly get it for you, but I'm not sure, Deputy Commissioner Martin, if you have that number.
Good evening. I'm sorry, I don't have that number handy, but we can certainly get that for you, Councilman Schleifer.
Okay, thank you. And
Councilman, real quick, repeat that, what the ask is.
just how many people have been vaccinated to date by the health department location?
And is that just to clarify, is that just health department, or is that partners, or is that in the city?
No, that's just health department.
Just health department. Nina, can we add that? What number is that? 9? 10? 11. Okay, thank you. Sorry, Councilman.
No problem. And have we vaccinated the homeless who are currently staying at the hotels?
We've had multiple vaccination events at the Lord Baltimore Hotel run by the clinical staff who support that location.
So have the people staying there all gotten vaccinated?
So again, there's a transient, and so there's turnover. So we've had multiple vaccination events. So it would really depend on who's there now versus if it's someone who's discharged. But throughout, since we've had vaccinations, the homeless population has been a part of who we started with first vaccinating. So we've had a couple of events there. So it would just depend who's there now. We have some individuals who are part of what we call the Haven, which are people with underlying chronic medical issues who are there for a longer period of time. Then we have other individuals who are there to isolate and quarantine, meaning that they're there for the shorter period of time. So they may have turned over. So it just depends.
I didn't realize there was turnover there. So can you explain a little bit more about that? So once somebody is vaccinated, how much longer are they staying at the hotel before somebody else has moved in?
So it depends if they're coming to isolate and kind of what stage they are. So we have people who come who are in kind of the last stages of the disease. And so maybe they're there for a couple days. We have people who come and they're they get their results back within 48 hours or whatever period of time. And so it totally depends, on what they're there for.
So it's only people who have COVID that are staying there.
So it's a combination. So we also have a portion called the Haven, which are people that have been identified from our shelter system that have underlying comorbidities. So they've been pulled out of the shelter system to be supported there at the hotel, where they get comprehensive care coordination. They also have access to vaccines. They get access to all of the other services that we provide, including meals, connecting to get an ID or other resources.
Somebody who's in regular health who gets vaccinated, they don't stay there long term, you're saying?
Right, exactly. Yep.
Gotcha. Do I get another question, Mr. Chair? What is the current recommendation on once somebody has COVID, how long should they wait before getting a vaccine, or should they not be waiting at all and just take the first available vaccine?
So generally, they should just wait until they've completed their isolation or quarantine period, unless they have received the antibodies. So if you get the monoclonal antibodies, then you do need to wait 90 days post-treatment with those antibodies. But if you just have COVID, once you've completed that isolation and quarantine period, unless you have the antibodies, you should be able to get vaccinated.
Gotcha. So are we adding the people who have antibodies to the list of folks to get to that 65% that we need to reach, being that they can't be vaccinated?
So it's all adults over the age of 18. We don't pull out necessarily individuals who've received monoclonal antibodies.
So the people who have the antibodies who can't get vaccinated for the 90 days, they're not included in the percentage that we're classifying as vaccinated towards getting to the point where we can remove masks?
That's correct. It's all adults over 18. We've not pulled out those who've received antibodies.
Okay.
Councilwoman Porter.
Thank you so much, Mr. Chair. Dr. DeRosa, I just want to commend you and your staff during this COVID-19 pandemic. I don't think that many people would dispute that public health is one of the major items that we should be funding, similar to what Councilman Cohen says. I have one question related to the sustainability of your particular programs. Now, you mentioned about 80% of the programs are grant funded and 20% are through the general fund. Is that an average amount, or is that what you're seeing amongst the programs that you mentioned?
That's across the department. So we covered every service area. So that's just across the entire department.
So
I'm not
more
sure if that answered your question.
Yeah. So some programs are more grant funded than others.
Yeah, I think, the general fund supports administration. It supports other things. And one thing I will say about the general fund is it does allow us some flexibility. So many of our grants are very prescriptive. So the general fund, we're appreciative of the support we get from the general fund because that does allow us a little bit more flexibility and allows us to do more innovative things that aren't necessarily just strictly as prescribed by a grant.
Okay. Thank you so much, Mr. Chair. That's all the questions I have for now.
Okay, colleagues and attendees, Councilman Costello was needed away. So I'll be taking over from here. We're going to move to Councilman Burnett at this time.
Thank you, Madam Chair, and good to see you all, Dr. Terrazas and your team, the Health Department, and thank you for all you do to get us through this pandemic, for sure. It's been a long road. The question I had first two questions were around service. I'm trying to find the service number. The slide that you had up around environmental inspections. So I sit on the one of the biennial audit oversight commission, and one of the things that came up was a state recommendation that we hire at least 41 health inspectors for business inspections, health safety inspections, that kind of thing. And one of the things that it's clear that we're not near that target. And so just wanted to note that for finance and the administration, the mayor's office, that this really does need to be a priority. But was just sort of trying to figure out, why we're sort of seeing a decline in the sort of a moving of the goalpost around the goal of being able to inspect 100% of the food service facilities rather than keeping it at 100% and working to get more inspectors to be able to reach the goal.
Sure. Thank you, Councilman Burnett. I actually have Deputy Commissioner Haller on the line to talk about this.
Hi, Council. Burnett, thank you for the question. I'm actually going to bring on Jessica Speaker, who is the Assistant Commissioner for Environmental Health. She can speak to the state mandate and how that question has been interpreted over time. Or rather, that measure has been interpreted over time.
Hi, good evening, Councilman. Yes, so you're correct in that the audit the state wants us to have 41 inspectors. We currently have 13 dedicated to food inspections. That's what we were budgeted for. 19 total in environmental inspection services. There are 4 for the ecology program and 2 for plan review, which are the people that open new businesses. So we did change our performance measure based upon the recent audit from BBMR. And that performance measure was about the state mandate inspecting this facilities. It's kind of a hard breakdown, but a high-risk facility we would have to inspect 3 times a year, moderate twice a year, and a low risk once every other year. With the amount of inspectors that we have, we would never be able to get that state mandate completed. So we did change our performance measure to total number of inspections by food control. It gives a bigger perspective of exactly what we're doing, because we don't just investigate, just do a food inspection, a routine inspection. We do complaints, we do foodborne outbreaks. There's a variety of different things. So by changing the measure, we will be able to hit at least every business, every food facility, at least 1 inspection, versus trying to get in there 3 times for a high risk and so on, 2 and 1 for the moderate and low. Does that make sense?
Saying prioritizing the resources that you have to, it sounds like, to try and make an impact based on what you have. I just think we obviously, as an agency, you're going to work with what you've been allocated, but I would love to see, and this is again more directed to finance, a prioritization of this particular service, particularly knowing how, there's been so much of an emphasis on the cleaning of surfaces and just overall, like during the pandemic, just how hygienic we aren't generally as a society. With such an emphasis on cleaning things that I now wonder how often they were cleaned before the pandemic. So yeah, just wanted to raise that as a important issue that I do understand the prioritization piece. So thank you for the clarity on why the metric is changing. I'll continue to push for more inspectors, because I still think that that's much needed, considering the scale and scope of what your 13 inspectors are trying to cover. So thank you for the clarification. My second question, Madam Chair, was about Service 307 on page 187. It mentioned that there were changes to the Here to Help hotline as it related to sort of a rebrand based on research and analysis that there was a need for that. Can you talk about some of that analysis, like what was the cause of the rebrand and what was it actually rebranded to? It seems like a helpful service, but just trying to get a better grasp of what the program does and why it was a change is needed.
Yeah, and I will speak, Councilman, very generally about that, as that program is led by Behavioral Health System Baltimore. But my understanding is that they had some focus groups. So it was previously the Crisis Intervention and Referral Line. And through focus grouping, determined that wording did not sit well with people. And so they used those focus groups to come up with the Here to Help as just a way of, again, rebranding it based on what they heard from focus groups across the city.
I didn't know it was not run by you all. Okay. Those are my 2 questions. I'll come back around, Madam Chair.
Okay, thank you, Councilman Burnett. We're going to move on to Vice President Middleton.
Thank you, Madam Chair. And my sentiments as well. Thank you, Dr. Darazi, for all the work that you and your team continues to do to keep us healthy and safe in this city. And so my first question Of all the offices, you have so many offices within the health department, what areas would you say are in the most need of employees? Where would you need the most help in hiring? What subject matter, what office?
So I think that's a hard question. And the reason why that's a hard question is I would say pre-COVID, and probably, many folks have read now that public health had been chronically underfunded. And so, I mean, I think I could look at probably every service area. We just started talking about, EIS or environmental inspection services that, have been challenged to have enough EIS support. And that's a national issue. That is not just a Baltimore City Health Department issue. So, looking across the departments, I would say that there's support needed in almost every service area. I think another example I could give is our work around outbreak investigation. So very quickly, early in the response, we had to rapidly bring in other individuals from outside of our kind of disease surveillance program to help with contact tracing. And at baseline, we probably should have had more contact tracers to begin with. So I don't know that there's one particular service area that I would point to. I would just say that generally there is a need to build out the public health workforce, and I think we probably all can agree to that based on this past 15 months.
Okay, thank you. And my second question, and I guess Deputy Commissioner Tan might want to interject with this one. As you know, I've been sitting on the care board for several years, and we haven't met in a while. And of course, our subject is always funding for our senior population. And just with you mentioning, 80% of your money comes from federal grants and 20% general fund. And we're always the seniors in our city, they compare us to all of our surrounding metropolitan areas, Baltimore County and Arundel County, that quite frankly they have better services that you can see for our aging, particularly our aging adults. And I just want to know how and then again through this COVID, you can really see the help that is needed for our aging adults. So where do we go from here? I mean, what do you have any ideas or plans, or do we need to have more conversations with our mayor? Just what kind of help do you need that can guide us as a council to advocate for that help for our aging adults in this city?
Great, thank you for that question. I mean, I think one thing I will say, and then I'll turn it over to Deputy Commissioner Tan, is much of the funding that we do receive from the state and feds are linked to population. So it's extremely important that we accurately capture the population just because of the formulas that they use to determine funding. And I mean, I certainly think from an advocacy perspective, and I'll go back to there's such a global need for funding, across the department. And with that, I'll turn it over to Deputy Commissioner Tan.
Okay.
Thank you, Dr. Sharasa, and thank you, Councilwoman Middleton, for your question and your advocacy and leadership, particularly on behalf of older adults in Baltimore City. As Dr. Sharasa said, most of our funding is tied to funding formulas based on population, and with the new census population numbers, we are anticipating a cut in state and federal funds, additional cuts in state and federal funds. And so we are advocating at a policy level to make the funding formulas more equitable. Every legislative session, we've been working on this to ensure that both the state and the federal government focuses on need-based formulas. On a local level, I think continue conversations with council and council members like yourself in terms of being able to advocate for our infrastructure. Dr. Sharasa had mentioned that public health has been gravely underfunded for too long. And the pandemic has shown this. We have focused with additional CARES Act funding and additional FEMA funding, have been able to expand our care coordination efforts and food access. And we look forward to working with city leadership to expanding services with the additional APR funding that is appropriated to the city.
So, there you go. So I guess this, having finance listening to this, I think this is a good time to kind of, at the ARP money that's coming our way. We need to have the conversations of how that can help our seniors through this, not just through the pandemic, but just help with the agency and the people, the seniors that are homeowners, have been here in this city for many, many years. We need to really start having a focus on them even more. And I'll just end by giving a shout out to the Zeta Center, because if it wasn't for that partnership, I don't know where, that's one of the most thriving senior centers in the city. And if it wasn't for that partnership, I don't think it would have survived today. And we need more partnerships like that, but we need more general money, more general funds directed in helping our people. So I'll end there. Thank you. Thank you for your comments.
Thank you, Vice President Middleton. We're going to move on to Councilwoman Ramos.
Thank you, Madam Chair. In following up with with the Vice President's comments about the senior programming, there are 5 services in the Health Department that are dedicated to older adults. And each one has a little bit of a different nuance. And I'm wondering, first of all, are the services coordinated so that the older adults are getting sort of all of that? There's also rec centers that have senior hours, and sometimes seniors go into the rec centers. Are they getting these similar services that you're providing? And just in general, how all of that is working, and then making sure that they're also getting access to the HUBS program to be able to help improve their home. So I guess just general sort of coordination for all of this, and then I'll have a different follow-up after that.
Great, thank you. I'll actually turn it over to Deputy Commissioner Tan to talk about care coordination for older adults.
Thank you, Dr. Shirasa, and thank you, Councilwoman Ramos, for your question. So yes, the coordination around aging services is coordinated. We are the city's area agency on aging. Much of the leadership and advocacy is coordinated through the Commission on Aging and Retirement and Education Services as the advisory board. The Maryland Access Point is the call center, the access point to access most of our services. There are about 28 programs within the Division of Aging and Care Services. We, as the 5 service areas, coordinate and work. We are working off of a 5-year strategic plan and updating that strategic plan through the Health Department. Your second question around the HUBS program, housing upgrades for Baltimore seniors. We have been very instrumental in supporting the HUBS work and the coordination and partnerships within HUBS, referral source through the Maryland Access Point to the HUBS program, in addition to expanding our falls prevention work from the referral source from the coordinators of HUBS as well. I think I've touched on some of your coordination questions, but happy to expand on any other questions.
So these outcomes, then, there could be the statistics that you have in some of these outcomes. It could be one person accessing all of these multiple systems. So these are not different people that are accessing these systems, right? So I guess we'd have to think about how to really talk about who we're serving, because this, 435 people number in the senior fitness program is probably the same as or some of them are the same as in, one of the other programs, right? So, because we have lots of seniors, as the vice president was just saying, that really need access to these services, and want to make sure that you've got the funding, but also that the outreach is there through us, through all of you, to be able to reach more. So I want to figure this out separately. We can figure it out for next budget, like how to talk about these services and who they're accessing, because it looks like you're serving a ton of people, but that may not actually be the case. There may be repeats here. And so to get a better picture of that, to show how, that we need to do, all of us together, do a little bit more work on that. So I appreciate that. I think those are my two questions, although I have a few more, so I'll yield for the next round. Thank you, Madam Chair, and thanks for your answers.
Thank you, Councilwoman. We're going to go to, it looks like Councilman Conway.
Thank you, Madam Chair, and thank you, Dr. Zaraza. I have a couple of questions. I'll try and focus on some of the high-level ones first, and when we come back around, we get to the others. My first question has to do with violence prevention, specifically Safe Streets. I'm assuming that falls into Service 718. Is that correct? Chronic
That is
disease.
incorrect. So Safe Streets is housed in Monty, the Mayor's Office of Neighborhood Safety and
Okay.
Engagement.
So as far as developing, the funding doesn't come out of the health department budget at all?
No.
Okay. I'll move on then. Thank you. The other question I had was with regard to Service 305. Service 305, Healthy Homes. So we visit roughly 500 homes and do inspections. Are there any interventions designed at the moment to support older residents as an effort to help them age in place?
Yeah, so that actually would likely not be necessarily in Service 305, which is focused on lead poisoning prevention, as well as asthma. But Deputy Commissioner Tan can speak to some of the senior programs. I mentioned one, which is the AIRS program, which is for older adults with Medicaid waiver. We have clinical staff that goes in and does an evaluation to determine what services they're potentially eligible for, so that they can stay in their home and age in place, as opposed to having to go to a long-term care facility. So that's one of our major programs. That's a Medicaid waiver based program. And Deputy Commissioner Tan, I don't know if there are others you want to mention.
Thank you, Dr. Terrasa, and thank you, Councilman Conway, for your question. Councilman, most of our programs, I would say 80% of our programs within the Division of Aging assist or supports older adults to age in place. We have the adult evaluation program that assess individuals who might be eligible for long-term care facilities. For the waiver program, the waiver program actually supports about 700 participants for homebound older adults to age in place, so provides in-home care services. Client services, direct planning and planning also provides in-home care services, deliveries of medication and support in the home as well. 725 community services for older adults who are viable community members, those who need additional support such as transportation, access to housing, rental support, and and food access. We're able to provide that. So most of our programs are wrapped around helping older adults to age in rate and prevent institutions for the long term. And if there are additional add-ons, I think I have Assistant Commissioner McGill. If there are other programs that I've missed, I'm happy to have him add on.
I think Deputy Commissioner Tan gave a good overview. In general, what we're trying to do is to provide people with the support they need to age in place based on their own preferences. I think that's a really important thing to emphasize, is that we try to work in a person-centered way so that we help people make the decisions that they need to make to stay in their own homes, rather than trying to impose our ideas upon them.
Awesome, thank you. It's great to know. The other question I have is also regarding focus more on Service 305. So does the health department work at all with the housing department when doing inspections? When doing inspections to notify the housing department that folks are not in compliance, whether it be for lead or any other potential concerns that would be important?
We do, and I actually have Director Camille Burke, who is over our lead program, as well as Director Margaret Schnitzer that does our asthma home visiting program, that can speak to how we've partnered with the housing department.
Thank you, Dr. Jaraza. Councilman Conway, we work with the health department in lockstep and hand in hand. We actually train with their inspectors. We have access to all of the districts for the inspectors. We actually share an attorney to make sure that we are actually, as I said, in lockstep, answering all their questions. We will do our inspection, and then housing usually will come right behind us and do an inspection, but we'll let them know if we found lead. We also educate the constituent on how to use 311 and the power of 311, because oftentimes they don't understand, especially around housing complaints. What we've also done in addition is that we've actually had all of our lead outstanding or lead violations uploaded into housing's violation system as well. So when someone goes to pull a permit, if they want to do some renovations, they will see that there's a lead violation outstanding as well. And we also do, in addition to that, for the housing lead reduction program on the Baltimore City housing side, we do all the education because we want to make sure we're all kind of rowing the boat the same way and speaking the same language.
Awesome, that's great to hear. Thank you. Thank you, Madam Chair.
Thank you. We're going to be moving into the second round of questions, and I'm going to be returning the committee back to Chair Costello at this time.
Thank you, Madam Chair. Dr. D, I know that the department is doing some great work around opioid abuse. Can you talk to me a little bit about that?
Sure. I see Councilman Stokes waving his hand.
I'm gonna take the liberty of being chair and pull my question back.
Yes.
And I'm gonna go to Councilman Stokes.
I never got the first round. I appreciate y'all letting me just get one in. I only have one though.
Sorry about that, Councilman.
That's all right. This is for Service 2723. The description for the service includes complaint, investigation for nursing home and assisted living facilities. How many investigations were conducted last year, and who conducts the investigation? If you don't have it, that would be a request, Mr. Chair, that we can get from Dr. DeRaza. And the follow-up would be, and do the findings tell us about the state of nursing homes and assisted living facilities available to our seniors? So the first question is, how many investigations were conducted last year, and who conducts the investigations?
Sure. I'll turn it over to Deputy Commissioner Tan. I think before I do, the one thing I will say is some things that were a bit more unique about last year, obviously because of COVID. We worked closely with a lot of long-term care facilities, as did our clinical partners, around general infection prevention. So there was a lot of engagement with our long-term care facilities around infection prevention, not necessarily related to senior complaints, but just saying, I think that certainly helped to strengthen the relationships we have with our long-term care facilities. And with that, I'll turn it over to Deputy Commissioner Tan.
Thank you, Dr. Shirasa. I'm trying to look up the numbers. I think we had closed. I have to defer to Assistant Commissioner Jim McGill on advocacy services for senior 723. I don't want to make up a number based on what I believe I remember. So Assistant Commissioner McGill, do you have the numbers of complaints we investigated last year for the long-term care ombudsman program? This is exclusive of what Dr. Shirasa said of the outbreak investigations.
I I don't have the exact number handy, but in general, we're ranging between 270 and 300 cases that we close each year in nursing homes in terms of investigating complaints. So we can get you the exact figure.
Okay. And my follow-up, and can you find out, do the findings tell us about the state of nursing homes, assisted living facilities available to our seniors? And I guess that had to come from the state. I guess that would be another, not a request, but can somebody answer that question?
Councilman Dix, are you asking how many nursing homes we have currently in Baltimore City and the number of assisted living facilities we have in Baltimore City?
No, it's from the investigations. What do the findings tell us about the state of nursing homes, assisted living facilities available to our seniors?
When you refer to investigations, are you referring to outbreak investigations or elder abuse and neglect?
Complaint investigation from nursing homes, assisted living facilities. And then the other question was how many were conducted, and the follow-up would be, the findings tell us about the state of nursing homes, assisted living facilities, and available to our seniors. I guess we're talking about in Baltimore City.
So Councilman Stokes, are you speaking of the quality of care being provided or the capacity?
Yes.
The quality of care. Okay. So that may be a question that we would have to follow up with the state on as well. So the state runs the Office of Healthcare Qualities for all of Maryland, and so they would also be pretty primary in looking across the care system. So we can follow up on that.
Okay, thank you. Thank you, Mr. Chair.
Thank you. Doc, I'm curious about the work you all are doing around opioid abuse. But real quickly, before I get to you, Bob, if you could jump to page 187 in volume 1, service 307, the performance measures. I noticed that 3 of the 5 performance measures for fiscal 20, we didn't have a target. Were we not tracking those in fiscal 20?
So I would defer to the agency on the performance measures on those.
Okay.
First, they're the ones that could submit that information.
Yep. So I'm actually going to turn it over to Deputy Commissioner Martin.
Okay.
Thank you, Dr. Jaraza. So we actually have been working with BHSB, who is the provider of the services in the service category, and we have worked with them and BBMR to update all of the performance measures in service category 307 moving forward into FY22. So what you're seeing in the budget book are the new updated performance measures moving forward, and that's why there is data missing for a number of those performance measures.
Well, I certainly appreciate you being proactive and tracking the actuals in 20, even though it wasn't a performance measure in the book. I think other agencies could certainly do that, so I appreciate that. And Doc, back to you if you want to just give me a overview of what you all are doing in this area.
Sure. So specifically, there are 2 committees that we host. So there's the Overdose Fatality Review Committee, which is a committee led by the health department, but inclusive of many multidisciplinary partners that reviews the overdose deaths across the city and comes together with those additional stakeholders. It's inclusive of fire, of OEM, of BPD, of the DEA, to make recommendations around policy changes as we're seeing and reviewing these past deaths and data on those previous deaths. We also have the Opioid Intervention team, again, supported by other state agencies, supported by Behavioral Health System Baltimore as well. And this particular team has worked with a consultant to develop a 3-year strategic framework that looks at how we're addressing overdose deaths. Specifically, they've come up with a couple of target areas inclusive of increasing education to providers around treatments options for residents, increasing just general awareness, especially among young people, around the risk of overdose death, as well as opioid use generally, increasing access and ways to get Narcan, specifically inclusive of providing enough training throughout the city for Narcan use, and increasing, really building much more support around funding and advocacy for overdose prevention generally.
Thank you. I appreciate all the good work there. I want to jump over to senior centers, service 721. When I'm looking at, I'm on page 226 of volume 1, it lists each of our senior centers under activities, 231K for Laxter Center. I'm assuming that's just staff, correct?
I'm going to turn it over to Deputy Commissioner Tan for that question.
Yep.
Councilman Costello, can you tell me what page you're on again? 220?
Yep, 226 in volume 1. I'm looking at the activity level.
Sorry, apologies.
It's all right. No, take your time.
Full
That's fine.
document, but if you tell me what you're referring to on that page for Senior Center Administration, I'm happy to answer.
Sure. So I'm looking at under Service 721, I'm looking at the activity level detail. And it lists all of our senior centers: Hatton, Booth, Oliver, Sandtown, Winchester, Laxter, Zeta, Hartford, as well as the independent senior centers. And my initial question here is that's just covering salaries for the operations of the center, correct?
No, Councilman Costello, that includes rent services. So most of the activities for Laxter, that's the cost of rent for Laxter.
Cost of rent as in, because we own the facility, right?
DGS owns for the facility, so we pay for the facility rental to DGS.
So you're basically doing a journal entry transfer over to DGS for using a facility that's under their control, essentially.
Yes, but I think that is typical of a building.
Oh, I don't have a problem with it. I'm just, yeah. Okay. So where do we cover in here staff and maintenance for those facilities?
So staff is covered by federal funding for Laxter.
What is that under Service 721, or is that under one of the
It's
other
under 721, and I'm happy because this service area is under Assistant Commissioner Molly Martin. She can specify the budget activities. Assistant Commissioner Martin, can you jump on to help Councilman Costello with some of his questions on Service 721, please?
Yes, absolutely. Councilman Costello, the salaries for all the senior centers, they differ depending on the funding sources that we get. We get several different funding streams for senior centers. The Laxter Center in particular, our staff is paid for through a CDBG federal grant that we get through housing. And then the facilities there, the rental costs we pay to DGS also covers the facility maintenance cost as well. So we reach out to DGS when we have a facilities issue, and it's covered as a part of our contract. Okay, so this gets to my question. Are we getting what we need to be getting out of DGS in terms of maintenance of our senior facilities? Specifically of interest to me is the Laxter Senior Center in the 11th. Hyung, Deputy Commissioner Tan, would you like to field that question, or I'm happy to answer as well?
Councilman Costello, DGS has been as supportive as they can be during this pandemic. There's always additional funding and capital needs that need to be supported for both the Laxter Center and all of the 7 city operated centers. There's definitely a need in investments in senior center operations.
So do we have deferred maintenance that you would consider critical to the operations of that facility?
The facilities have been maintained. Last year, we just finished an elevator maintenance project. There have been some additional projects that is required at Laxter Senior Center, including roof repairs and other maintenance areas as well.
Okay. Nina, if we could add a request here, can I get a breakdown of what type of deferred maintenance is necessary at Laxter, as well as what the line item cost is for each of those things? I think that's 12. All right. Thank you.
Thank you.
Appreciate it. Thank you, Deputy Commissioner. All right. We've cycled through everyone so far. Does anyone not ask questions yet? Okay, I'll start back at the top. Council President Mosby.
Mr. Chair, I'm fine at the moment.
Thank you, Mr. President. Let's go to Councilman Burnett.
Thank you, Mr. Chair. My first question was about Service 311, health services for seniors. There was a obviously unsurprising dip in the metric for companion hours for seniors, which again, don't have to explain. I get it. It's obviously related to the pandemic, but would want to know what is being done moving forward, knowing that one, seniors are overrepresented in community or the sort of the demographics of folks that struggle with the digital divide and access to the internet. How is the agency adjusting to what will likely be a new reality for all of us moving forward, that there's going to just have to be more of a reliance on virtual engagement?
Yeah, that's a good question. I'll actually turn it over to Deputy Commissioner Tan.
Thank you, Dr. Shirasa, and thank you, Councilman Burnett, for your question. So 311, there was a dip because the reason why in-home care services for 311 was decreased in that service area, just to answer your question, was that the volunteers that provide companionship were older adults themselves, and so to protect them, we had to pivot from that model for senior companion. The federal government, the federal program that does fund that program is going to reinstate, provide guidance to reinstate that program in the next several months. But to answer your question around closing the digital divide, the pandemic has really hit older adults hard. This year in particular, we had to pivot really quickly from providing basic needs for food delivery services to keep older adults at home, to keeping older adults at home during cold red season, as well as expanding our care coordination efforts for older adults. Just more recently, we've been working with the city to close the digital divide and providing virtual senior centers, as well as working with multiple partners to close that digital divide that we often don't think about with older adults. But it was an extreme challenge, and we saw that with the vaccine access work. When all of the registration process was online, we had to really, our Maryland Access Center fielded sometimes in a given day over 1,000 calls from older adults asking for vaccine support. And so we really have closed the gap by expanding our care coordination efforts in the Maryland Access Point, working with partners to advocate and find additional funding sources to close that digital divide, in addition to providing the basic needs that older adults need to age in place at home. I'm happy to specify and other strategies in which we are expanding this work and looking forward to working with our partners and coalitions to to expand our programming for older adults here.
And it sort of ties into my second question, 303, the clinical services, which also saw a dip in visits to the clinical sites. I guess broadly speaking, what do you think the impact, or projecting that the impact could be for people who may have STIs or that have gone untreated, or sort of these other sort of illnesses that they would have been coming to a physical clinic to get support for. What does that look like moving forward to try and get those folks to come in now that things are reopening, and also just sort of the, I guess, the public health impact writ large?
Yeah, thank you for that question, Councilman Burnett. I'm actually going to turn it over to Assistant Commissioner for Clinical Services, Dr. Adina Greenbaum.
Hi, can you guys hear me? Great. Thanks for asking that question. So we, of course, are concerned about some of the clinical impacts of people missing out on their routine care and missing out on some of the preventive services we were able to provide at that point. Here, you can join it. You can say hi to all of the neighbors' friends. So we are expanding our clinical services at our clinic. We have not yet reopened up our walk-in services yet. That, of course, poses the biggest challenge in terms of safety to our staff and patients, but we are slowly continuing to increase our clinical services that we provide and our other prevention services. We already are seeing some of the impacts, we think, of some of this. One example would be some of the rates of congenital syphilis that we're seeing right now in the city. So we're following those rates very closely. And so we're following some of those rates very closely in the city and thinking about what sort of multi-pronged approach we can take, working closely with maternal and child health within the health department, BHSB, and some of our other partners external to the health department. Did that answer your question?
And I guess as you move along, I definitely would like to hear a little bit more about that work. Definitely an interest of mine overall. And when I saw that, the decline, obviously, again, to be expected given the environment, but we were just curious as to what the pivot was going to look like moving forward. Thank you, Mr. Chair. Those are my two questions for this round.
Thank you. Councilwoman Porter.
Thank you so much, Mr. Chair. I wanted to talk through the staffing model of the City Health Department. Can you speak to some of the barriers that you all experiencing being a fully staffed health department?
Can you be a little more specific when you say barriers, as in, are we
Sure.
understaffed or?
Yeah, I'm sorry, Dr. DeRosa. Barriers to hiring, to ensuring that you all are fully staffed. So that can be barriers with human resources. That can be barriers with finding capable talent in Baltimore. Yeah.
Yeah, I mean, I think, obviously, yeah, I've spoken a little bit about the chronic underfunding for health department generally. I think we always want to also work to ensure that our salaries are competitive as well. Especially in the pandemic, there was a nursing shortage, for example. I'll use the nursing shortage, prior to the pandemic, and then it, became even more challenging once the pandemic hit and nurses were in such high demand. To really be able to competitively bring on additional clinical staffing within the health department. So I mean, I think that is a challenge that again all health departments face during this time, and I think even hospitals maybe dealt with some of that as well. So that's always a challenge.
Okay, thank you so much.
Thank you, Councilman Conway.
Thank you, Mr. Chair. I actually want to follow up on your question around opioids. I know one of the things we track pretty rigorously is, of course, opioid deaths, and I think a lot of our work has been specifically focused on preventing opioid deaths. Do we have any efforts, or do we partner with folks on any efforts to help folks who are trying to transition away from opioid use into regular life again? Do we have any programs like that, or do we partner with anybody on those efforts?
So Behavioral Health System Baltimore is as we're the local health authority, they're the local behavioral health authority. So they regulate the public behavioral health system here in Baltimore City. And we do have a very close working relationship. Again, those two committees I mentioned, the OIT or Opioid Intervention team, as well as the Overdose Fatality Review. We work hand in hand. with BHSB in both of those committees to ensure that there's adequate service delivery across the care continuum. Internally, we also have our mobile spot van, which provides buprenorphine, provides medication-assisted treatment for residents experiencing substance use disorder. And we work closely with IBR Reach, which is a clinic that supports, again, medication-assisted treatments, and see their clients or refer clients to them so that we can connect residents with the medication-assisted treatment. Additionally, we have our syringe exchange services program, which provides harm reduction, provides Narcan and naloxone training, as well as connection to resources.
Awesome. Thank you so much. Thank you, Mr. Chair.
Thank you. Councilwoman Ramos.
Thank you, Mr. Chair. Going back to that same service, 307, you mentioned Commissioner, oh, first of all, I keep meaning to say this. Kudos to your social media people. They are amazing, you know, with the pandemic and getting people's attention. They fought off the Russians, which I thought was hilarious. So anyway, kudos to them. Kudos to you for letting them just do their thing. And I think it's great. So thank you for that. And of course, thanks for all that you do and your team is doing. Going back on Service 307, it says here in the page 187, it says that beginning in June, emergency line operators will connect those experiencing suicidal ideation to trained behavioral health specialists. It was my understanding that the program was supposed to be for people having any kind of mental health disruption or crisis, and not just suicidal. So can you explain that a little bit? And then as a follow-up, is the connection simply a phone call, or are trained clinicians somebody who can actually work with the person face-to-face, actually going out to address the issue?
Sure. I'll actually turn it over to Allie Smith, who is on the line and has been very pivotal in helping to set up the 911 diversion program. So Allie, if you're responding, you're muted. I'm not sure if you heard the question from Councilwoman Ramos.
I did not. Could you repeat the question? I'm sorry.
Sure. I was looking at the new 911 diversion program, and in the budget book it says that specifically calls from people who are experiencing suicidal thoughts or ideation would get paired with a trained clinician. I thought, you know, maybe I'm wrong, but I thought that this was for a lot of other mental health issues that people might be having as well. So if you could talk about, you know, what that's actually doing, and then are they only connected by phone? So the clinician is talking, or the provider is talking to the person by phone, or will somebody physically go and help the person through their manic, whatever it is that they're dealing with?
Okay, thank you. And thank you for repeating the question. So yeah, the 911 diversion pilot is starting with 2 specific call types. So we recognize that it is starting with like a very small specific like pilot, and they both have to do with suicidal ideation. But the aim of this pilot is that it, you know, there's no end date for it. The goal is that it's an iterative process, and that we're continuing to expand it to include more types of behavioral health calls, but we're starting with a very small subset. And the 2 call types that we are beginning with account for about 1,000 calls to 911 per year. So those 2 call types will be first transferred to the Here to Help line to talk with a mental health clinician. And then if determined necessary, they would be sending a mobile crisis response team to the scene. So it starts with being transferred to a clinician. And then if needed, there is a in-person response.
Thanks. If I can follow up, there is a small program happening before this new one was established, and it was diverting about 800 calls, I thought. So that is the 1,000 in addition to the 800.
I'm guessing that these are the same. I'm not sure what you mean by another program was beginning or another program was
I
occurring.
guess
We might be talking about the same ones.
Yeah, sorry. I just thought that my understanding was that there were some calls already being diverted, but it wasn't fully fleshed out. It wasn't completely, so I can get back to you on that. But my understanding was that the program there was something happening, diverting to BHSB at some point, and then this new program was to divert even more calls.
Okay, so I guess maybe this will help like clarify the larger picture in that so the place that they're being transferred is the Here to Help line, which is something that already exists. So people can call that directly if they want to versus 911. And the mental health clinicians that would be responding to those diverted calls are it's a community crisis provider that already partners with the crisis response team within the police department as a co-responder model. So that's something that already exists, but this pilot will be a complete diversion away from a police involved response. And as we move forward with it, we'll look to what are additional behavioral health calls that we can expand to, and then beyond behavioral health, what can we be expanding to for that?
Okay, thanks. I appreciate that. And then my second question is a totally different subject. Dr. Duraza, you said that the school health nurses come through the health department. Does every school get a school health nurse this time around? And or are they sharing hours? I understood that during whether we were going to reopen or not, there was a concern that not every school had a nurse 24/7. And of course, when we go back in September, that's still going to be really important because we still don't know whether our kids younger than 12 will actually be vaccinated. So can you talk a little bit about that? And I know you're probably working with the school system now on trying to figure out, that reopening part.
Yeah, so my understanding is right now we have, I think, 22 schools that have full-time nurses. The majority of our schools do share nurses that travel in between schools and might support a school anywhere from 1 to 3 days per week. But there are certified nursing aides at the schools that don't have school nurses. And Assistant Commissioner Childs, if I left anything off, please feel free to interject.
No, that's, I think you've covered everything. I think that it's important to note that schools do have some coverage every day, and the certified nursing assistant does provide delegated nursing functions. We are, as Dr. Duraza said, trying to increase the number of nurses that we have, but we're competing with others with larger pockets than ours.
Thank you. Thank you, Mr. Chair.
Thank you. Councilman Cohen.
Thank you, Mr. Chair. Again, thank you, Dr. Duraza and your team. Commissioner, we saw during this last year, just again, the importance of public health and your department. We know that this likely will not be the last pandemic, that there are other strains of COVID-19, that there will be, in all likelihood, some other major pandemic, certainly within our lifetimes, but probably within the relatively near future. Based on the experience of this year and the scramble that you and everyone else had to do you feel like we are well set up for the next major public health disaster that we will inevitably face in Baltimore?
I think as of today, we're working on it. I would say no. I think the challenge, and so obviously we're appreciative of all of the new and additional funding sources that are coming in, but many of them are short-lived. And I think we really need to build up our public health workforce for the long term, not just for a few years, because of what you mentioned, right? This was one threat. There are many others lurking. So I think while I'm appreciative that there's funding that exists now and will be there for a couple of years, really thinking about what happens when that funding goes away is the challenge.
Yeah, no, thank you. Again, I think just to reiterate, the serious cost that if we don't fund public health now, we will pay later. Thank you, Commissioner, and thank you, Mr. Chair.
Thank you. Council Vice President Middleton.
No further questions.
Thank you. Councilman Dorsey.
Hi, Mr. Chair and everybody. Sorry, I was just extracting a very large carpenter beehive from my basement that has occupied me for the last couple of hours. It was an emergency. So I appreciate you
Can't
coming.
you 311 that to animal control in the health department?
Oh boy, it wouldn't be quite as adventurous if I had. And then I'd have to deal with liability of them coming onto my property and all of it. But it's all handled now. No, I have no questions. Thank you, Mr. Chair. But thank you, Health Department, for being awesome. And I heard Councilwoman Ramos giving you all your due credit for great social media, and I just totally concur. You're just doing a great job. Everybody's really happy in the city, I think. At least all the sane people. So thanks.
Colleagues, any other questions? Councilwoman Ramos.
Dr. Draza, I don't know whether you have the information for this, but my predecessor asked me to ask this of you and also the Rec and Parks. Her very last bill that she passed was the pesticides bill, and the pesticides that to ban certain pesticides, and wanted to know, what's happening to be able to prepare for that in terms of inspections, in terms of helping all of the agencies that my colleague articulated earlier in the day that all mow lawns, and how that's working. In terms of getting, I don't think it gets enacted for another year, but in terms of getting ready for getting that together.
Yeah, thank you for that. So we're prepping, as you mentioned. I believe we have another year. So now we would just focus on the planning ahead of that.
Okay, great. I'm sure you are on it. I just wanted to make sure that that I asked the question. So thank you.
Colleagues, any other questions? Dr. D, just want to say thank you. Your team did an incredible job during the pandemic. Understaffed, under-resourced for that type of effort, but you guys performed amazingly. Want to thank the social media folks, Adam Abadir, of course. Thank you for letting him run with that. That needed to happen. Want to take a moment to thank someone who I know played a huge role in the response to the pandemic, who has left the city, Jeff Amorose, who did a phenomenal job. Want to take a moment to thank Kathy Smith, counsel for the health department, for her work on the executive orders and collaboration with myself and other folks that were working with the business community during that. And especially want to thank Mary Beth Haller, Jessica Speaker, and Jerry Welch, the folks that, among other things, do restaurant inspections and have worked incredibly hard with our small business community during the pandemic. So Thank you all. Dr. D, keep up the great work. Colleagues, we will be back tomorrow, 9 a.m. sharp for Baltimore Development Corporation to start off day 2. Thank you, and we are now in recess.